Doctors warn of 8 new COVID-19 symptoms discovered. The common symptoms of the coronavirus are well known worldwide by now. These include fever, dry cough, and shortness of breath. But a new study published by Northwestern Medicine in Annals of Neurology has claimed that people are now experiencing new coronavirus symptoms. These new symptoms are being experienced much before the more common respiratory ones. This is due to the nervous system being damaged by COVID-19. So, in this video, we will tell you about 9 such symptoms. 1. Inflammation in the brain. In Dr. Spudik and her colleagues' comprehensive review article, they outlined the fact that COVID-19 can directly infect neurons. This causes changes in the sense of smell. As a result, the body's immune response may cause inflammation in the brain, which leads to confusion and headaches. It even affects other organs, including the blood vessel system, which predisposes to a stroke. 2. Terrible headaches. Patients infected with COVID-19 frequently experience new coronavirus symptoms, with the most common ones being headaches. She says they are sometimes part of the overall illness accompanying fever and respiratory problems, and sometimes manifesting as the primary COVID-19 symptom as prolonged or severe headaches in patients with usually well-controlled migraines. According to the description from patients, these headaches seem to feel like a painful, throbbing sensation. 3. Smell and taste disorders. Among the new coronavirus symptoms, loss of taste and smell has been frequently reported by many patients with COVID-19 from all around the world. Dr. Spudik explained the causes of this are uncertain, but may relate to viral infection or inflammation of the nerves and regions of the brain related to smell. 4. Decreased concentration. There have been many complaints about difficulty with concentration and severe fatigue from patients of moderate to severe cases of COVID-19. According to her, for some individuals, this is so severe that they develop sleepiness and confusion, or even have a prolonged waking up period after receiving sedating medications in the hospital. But in the majority of the patients, this usually resolves itself once they recover. However, detailed research is yet to be conducted to better understand there could be any potential long-term effects. 5. Alterations in your mental state. Dr. Serena Spudik stated a wide variety of neurologic syndromes and symptoms have been reported in patients with COVID-19 since very early in the pandemic, including most common alterations in mental status, headaches, loss of smell and taste, and stroke. A review published in JAMA Neurology by Spudik and her colleagues provided detailed information about the impact of SARS-CoV-2 on the central nervous system and its neurological complications. 6. Stroke. COVID-19 can also cause serious complications in patients, such as a stroke. This can lead to long-lasting effects like the loss of speech and sudden weakness of one part of the body. Strokes are mainly seen in COVID-19 patients who are already at risk of them. These include elderly patients with certain heart conditions or high blood pressure. There have even been a few cases of strokes in younger patients with no clear reasons. Dr. Spudik explains a variety of factors in patients with COVID-19 may predispose to stroke, including blood clotting abnormalities, inflammation of the blood vessels, and in the most severely ill patients, changes in oxygen levels and blood circulation. 7. Dizziness. Another common neurological symptom of the virus is dizziness. Dr. Spudik pointed this out and said some patients, particularly elderly patients, develop difficulty with balance and even fall when they develop fever or illness that involves the lungs and the rest of the body. She even revealed that stumbling and falling at home due to dizziness can be an initial implication of the virus. 8. Numbness, weakness, or muscle pain. Besides the neurological symptoms, there are other new coronavirus symptoms that range from muscle pain and aches to severe weakness of the arms and legs. Dr. Spudik says these may be due to direct effects on the muscles, leading to achiness, weakness, and increase of levels of muscle breakdown proteins in the blood. How to keep yourself safe and healthy? The CDC has provided numerous instructions on how the transmission of COVID-19 can be stopped or reduced. This will prevent you from ever experiencing any of these terrible new coronavirus symptoms. Some of these include wearing a face mask, practicing social distancing, washing your hands regularly, getting tested if you are experiencing coronavirus symptoms. So friends, this video was all about how to stay healthy and stay safe. Thank you for watching.